California Senator Alex Padilla is co-sponsoring the Affordable Insulin Now Act that would cap out-of-pocket costs on insulin. KCRA 3's Marisela de la Cruz explains more about what this means for people who depend on this drug.
I'll be right over here.
As 34 million people in the country battle diabetes,
putting a cap on the price of insulin would mean that people who need it to stay alive can afford to stay alive, and they don't have to decide between rationing their insulin or paying the rent.
Lawmakers are attempting to address insulin costs, which have affected countless Americans who depend on this medication.
1 in 4 of the insulin users who they surveyed reported that they had rationed their insulin, reduced their doses below what they knew they should take, what their doctor said they should take, in order to pay the bills.
According to the Healthcare Costs Institute, insulin prices have nearly doubled between 2012 to 2016. But rationing medication to save money could be fatal.
It puts them at risk of diabetic ketoacidosis, which is the potentially fatal complication of usually type 1 diabetes that happens when your blood sugar goes completely out of control.
In a study before COVID vaccine availability, researchers found that diabetics were also among the most affected.
In one of the large studies before there was a vaccine, 40% of the deaths from COVID-19 were in people with diabetes, which is, way more than twice the rate of diabetes in the population as a whole.
The Affordable Insulin Now Act would cap the monthly out-of-pocket cost of insulin at $35 for people with commercial insurance, group health plans, Medicare, and California's Medi-Cal. Marisela de la Cruz, KCRA 3 News.
1 of every $4 spent on health care here in the U.S. is made by people with diabetes. That's according to the American Diabetes Association. The Affordable Insulin Now Act has been passed in the House and is headed to the U.S. Senate.